This is a multi-center international trial. It was conducted across 7 low-middle income countries as part of the NICHD's Maternal and Child Health Network. And we aim to see if intravenous iron administered postpartum was superior to oral iron for moms who delivered and were anemic, and improving everyone's hemoglobin and other measures at 6 weeks and 6 months postpartum. And so what we did was we screened moms who had delivered at 6 to 48 hours postpartum with a hemoglobin, and patients who had a hemoglobin that qualified as moderate anemia, or between 7.0 and 9.9, were allowed to be included and randomized in the study. And then participants were randomized to either receive up to 1 gram of a single dose infusion of IV ferric carboxymaltose, which I'll usually say FCM for short, or to do oral iron twice daily through 6 months. And we followed them up at 6 weeks and 6 months, looking at hemoglobin, iron indices, and depression, quality of life measures, and breastfeeding. And what we found was that with a single dose intravenous iron infusion in that immediate postpartum period was better than oral iron in achieving a non-anemic state, or a hemoglobin of at least 11 at 6 weeks postpartum. And also, those patients in the IV iron group also had a higher rate of achieving a hemoglobin of at least 12 at 6 months postpartum. And importantly, when we looked across regions of the world, Guatemala, Africa, South Asia, that benefit of intravenous over oral iron was seen across those regions. And we also looked and saw that that benefit of intravenous versus oral iron was seen across baseline hemoglobins, with greater benefit with IV iron seen, especially even at lower hemoglobins. We did not see any difference in rates of postpartum depression or other quality of life measures, although the overall rates of postpartum depression we found were lower than we were expecting. But ultimately, our findings demonstrate that giving intravenous iron in that immediate postpartum period not only results in improved resolution of anemia at 6 weeks, but likely 6 months postpartum. And that has important implications for both long-term reproductive health and potentially even future pregnancy health. So for this study, we were allowed patients to be screened anytime between the 6-hour to 48 hours postpartum, and that was to accommodate various postpartum workflows across the sites included. We haven't looked at if there was a difference in benefit based on when that screening hemoglobin was done, but given that the study included screening patients in that time period, I think it's reasonable to adapt that to individual settings based on when you might routinely do a postpartum hemoglobin. I think that's a really great question, and I love it because actually one of the biggest risk factors for anemia in pregnancy is multiparity, or having had prior deliveries. And although, this trial, of course, we haven't followed our participants out through their next pregnancy, I think what our trial highlights is the fact that immediate postpartum anemia can and does persist for months, especially if not managed. And so you can take these findings and think about what is the best way to manage postpartum anemia and bring our patients out of that anemic state. So we're really setting them up for success, both in future life as well as future reproductive and pregnancy health. With this trial, and our trial results really can't answer that specific question. Patients who were considered for a blood transfusion were not eligible to participate. And so this does not compare the use of IV iron compared to a blood transfusion. Overall, there were very few serious adverse events in our trial related to the IV FCM infusion, less than 1%. As with any medication, it's always important to review the prescription guidelines to make sure that it's a medication that's appropriate for your patient, the patient in front of you. For this trial, all the study staff were educated on how to administer the infusion, how to recognize a potential infusion reaction, and how to manage that. And so, of course, any kind of medication infusion should be done in an appropriate setting with trained staff. There is also a known low rate of hypophosphatemia that can be associated specifically with IV-FCM. It's not usually clinically significant, but it may matter to your specific patient, and that's something that should also be taken into consideration. Well, I think intravenous iron, can certainly be administered in a hospital or in an outpatient setting. It is not restricted to a hospital administration kind of drug. That being said, I think the key point is really healthcare access. Unfortunately, historically, both here and in other places, here being in the United States as well as around the world, postpartum follow-up is not always great. We know moms are busy taking care of their children and not necessarily taking care of themselves. And so the immediate postpartum hospitalization really provides a convenient point of intervention, but certainly intravenous iron can be administered as an outpatient.